welcome to this special podcast, which is focused on heart care, cardiovascular. Uh, you know, we explore healthcare, well being uh, with the people shaping it. And today we are delving into something which touches every life, and the fear of it is absolutely real. We are talking of heart health. Uh, we've all seen the headlines and the concern about younger people succumbing to heart and cardiac conditions. Uh, it raises questions on lifestyle. It raises question on the genetic framework of different people from different ethnic groups. And to discuss this, I have with me Dr. Rajay Narain, who is the founder chairman of GHA Health in UK, and he's someone who's also brought out the importance of integrated health and integrated clinics while addressing heart care. Thank you so much for taking
Thank
our
you, Mr.
time,
Narula. Thank you
Dr.
very much for
Narain.
having me.
So let's get started on heart care. How has heart health and the concern around heart health and the care that we have for heart care, cardiac conditions, evolved in the last 20 years?
So I think we were discussing this earlier as well, that if you look at the causes of death globally, heart is going to be the number one killer in the next 20 years as well around the world. And it is one of the biggest killers, as we know. But more importantly, what has changed is that we are now understanding that the changes in the heart, they don't start in your 40s and 50s, which we're discussing. It starts in your 20s and 30s. There are so many different tools, artificial intelligence based or CT scans and other tools that we use to pick up heart disease early in our 20s and 30s. And again, addressing those challenges with lifestyle, diet, exercise, all that are very, very important, because we know research has now shown that all these changes, blockages in the heart arteries, they start in your 20s and 30s. And obviously, if you have risk factors like blood pressure, diabetes, cholesterol, family history, if you smoke, if you don't exercise, if you don't sleep much, all these are risk factors that can lead to speeding up of that blockage in the heart. So awareness is extremely, extremely important. We need to be aware of about our overall health, and obviously heart health, because heart health is related to your overall health. If you don't keep yourself fit, then all these risk factors that we are talking about will lead to problems and changes in the heart arteries. And that leads to early heart attack. So one is that there is increased awareness now globally that people are getting themselves checked early, and that's the right way forward, and that's the right thing to do. We should be doing more that in the Indian subcontinent, in Indians, because we know that heart disease is very prevalent in India. So getting yourself checked for all those risk factors early is very, very important. Having the right lifestyle, diet, exercise, sleep, and again, that will make you fitter to meet some of those challenges in your 30s and 40s. Because if you start struggling with your health in your 20s and 30s with diabetes or high cholesterol or obesity, for example, overweight, all that puts you at higher risk to develop cardiovascular event in your 40s and 50s early, and also helps you to, again, if you lead a healthy life, then obviously it helps you to meet some of those challenges which you will not be able to meet if you are unfit. So coming to how heart health has changed, how heart care has changed, we are using more and more of artificial intelligence technology. We are, especially in the field of radiology, we are using artificial intelligence to pick up some of those changes in the CT scan, which can tell us that this person is likely to develop more changes compared to someone else. So technology is definitely helping us. But I think the key here is that we should not need any of those technologies and be fit ourselves so that we don't need help from doctors.
But what you brought up is something really, really important, Dr. Narain. What we have, or that's my understanding and my observation around people around me, that it has always been very reactive. किसी को कब प्रॉब्लम हो गई, symptoms आए, तब तो we all run towards the hospital. We become very mindful about what we do.
Yes.
But until then, we have not really focused on what could have prevented this.
Correct.
There's a shift in mindset that needs to happen. How do you think we could create that?
Very important question. And I think we should learn from what other countries are doing. For example, Italy was one of the countries in the world where sudden cardiac death was happening like left, right, and center in 80s.
Mm-hmm.
But they brought in a screening program to prevent sudden cardiac death in young people.
Mm-hmm.
And Italy has cut down their risk of sudden cardiac death by 80% plus by screening the right people, right individual in the right age group in their 20s and 30s.
Right.
So that is just an example of how research can help you. We already are aware, and I'm sure everyone is aware, that we are more at, especially being an Indian and South Asian, we are more at risk of developing blood pressure, diabetes, cholesterol, family history, our diet, lifestyle, cooking. Everything is slightly different from compared to European Danish diet or compared to a Mediterranean diet. So I think what is important here is to be aware of your risk factors, get yourself screened early, which is very, very important. So the key message is 100% prevention, because you cannot wait for your 40s and 50s to get your first heart attack, first stroke, and then start doing something about it. By that time, a lot of changes have already taken place in the heart muscle. For example, if you get a heart attack, some part of the heart muscle becomes dead forever. You're likely to develop heart failure. Heart failure has got only 50% chance of surviving beyond 5 years. So I think it is important that we start early, we screen early, we take all the right precaution, because we now understand that changes have started happening in 20s rather than waiting for 40 and then start doing something about it.
Dr. Narain, in the past, you and I have had a conversation around screening and which ethnicity requires screening earlier than the others. What is the right age to start looking at our bodies so that we can prevent the cardiac challenges that could come to us later?
Absolutely. And as I said earlier, because there is again some paper published from some of the cardiologists in India who suggest that they have seen increase and surge of coronary artery disease, heart failure in people in their 30s. So that is not seen in European countries. That is not seen in Americans. What we are seeing in the Indian subcontinent, in the Indian perspective, is that people are developing changes which may be pre-diabetic condition, small changes in your lipid profile, small changes in your weight, your lifestyle, your stress. All these contribute to all those changes that we talked about in the coronary arteries, because plaque formation starts early, blockages start early, and that leads to heart attack or a stroke depending on where the blockage is. So I think the key message here is that whatever limited research we have, one of the other things that I think we need to focus is on research, because research is something that we really need to work very hard. We lack data when it comes to heart disease, especially in India. We don't have enough numbers or statistics to say what really is causing these problems. But whatever limited data that we have, we know that these changes are happening early in Indians. So the prevention also has to happen in 20s. As I said, that if I'm in UK, an adult will get checked first time when they hit 40. I think the government should start having a scheme here in India. The moment you hit 20, you should get your first blood test, blood pressure, diabetes, cholesterol, lipid profile check, and a full lifestyle check. Make sure that you're not obese, overweight, and take all that precaution that will prevent problems from happening in 30s and 40s.
But Dr. Narain, when you look at the past, the traditional understanding is that even in India, we were getting heart attacks much later in our life. And our belief is that we should take care of our bodies much earlier. We should be exercising while we are younger. But something that we have observed is that people, while exercising in their early 20s and 30s, are succumbing to sudden cardiac arrest. Why is this happening?
So this is again more the case post-pandemic. We have seen a surge of cases of sudden cardiac death, maybe because a lot of important people or celebrities have died, that it made headlines and people have become more aware, and possibly it was happening more before pandemic as well. But we don't have statistics. The reason
is that we have started observing
more, because again, some important people have passed away. The singer who died in Calcutta, or some important TV actor who died in the gym. So I think what we need here really is, number one, if you look at statistics from where I work in the UK, every week 12 healthy young individuals between the age of 14 to 35, 12 every week die from sudden cardiac death. Every week, sudden cardiac death hits 12 people in the UK. Why do we know this? Because we have got database, research, evidence, postmortems, and we know that this is what is causing death in these people. So we are emphasizing to get younger people screened early for heart, muscle, and conduction system, because again, coronary artery disease is less prevalent in those countries. But coming to India, I think we don't have a database. So no one in India I can challenge can give you an answer why people are dying suddenly from sudden cardiac death in India post-pandemic. These are all assumptions that this is a heart attack, this was possibly related to COVID vaccine, which we are not sure about. The only way to find out whether you are dying from COVID-related problems or heart muscle problems or heart conduction problems or blocked artery problems is by doing a post-mortem after death. That only does not give you a database, but also prevents the family members from having something else. So I know it is slightly challenging the way our social setup is, that people don't allow their loved ones to have a post-mortem, especially younger people to have a post-mortem in India. But I think that thinking has to change, because that is not only helping the society, but is also protecting your family. Because that person who died may have a condition, genetic condition, that is present in one of the parent or one of the brothers and sisters, and you can prevent the family from having any other problems in the future.
Absolutely. I think that's a very, very important point. We have seen a slight change in the mindset of people, especially after pandemic. People have become more aware of, what they need to do to build immunity, what they need to do to ensure that they are healthier than what we assume them to be, and they get themselves checked. Is there some red flags that probably are missing in our screenings that we need to be more mindful of, that the fraternity, the scientific fraternity needs to work on, that could make our tests better?
Correct.
And make it safer for people?
Absolutely. There are a couple of things that I would like to add here. One is obviously your full profile that majority of the labs do in India, which consists of your lipid profile, thyroid, hemogram, looking at a kidney, liver function. Those are all very, very important, because that tells you all your risk factors. Getting yourself checked for blood pressure is very important. So again, all those blood tests that are done. But apart from that, there is now evidence to suggest that some inflammation is happening inside the heart arteries, which is responsible for the blockages in the heart arteries. So adding a CRP blood test, which is looking at inflammation inside your body, is very important. We have also learned about a very special kind of bad cholesterol, which is called an LPA. So LPA should be done once in your lifetime, because LPA is a bad cholesterol, is an independent risk factor in the presence of normal cholesterol. So you may have completely normal cholesterol, but your LPA may be very high. So LPA is like a naughty cholesterol, like a bad cholesterol that can lead to a lot of changes in the heart attack, heart disease. So LPA is something that we should be adding to our blood test. CRP is something that we should be doing to look for inflammation. Those are some of the tests that we are doing more and more in the European countries to pick up inflammation and changes before they happen.
And Dr. Narain, in your experience up to now, have you come across a patient or a situation where you had the young patient whose case deeply impacted you and brought out the gaps that are there, which need to be addressed when we are looking at health?
Yes. I think there was a very interesting case of a 17-year-old boy who used to do basketball in the UK where I was practicing. He was getting some dizzy episodes, but the family was aware and the child was aware that dizziness while playing could be a red flag. The coach suggested that no, this is just because of your dehydration and you're not feeling well because it was the heat. But the family were aware that something can be wrong. So they went to their GP, their general practitioner, and they got referred to a cardiologist where an ECG and echocardiogram of the heart was done. And he was found to have problems with the muscles of the heart, which is called hypertrophic cardiomyopathy. Again, it's a condition where your heart muscles get enlarged, the heart becomes very weak, and it can lead to sudden cardiac death in some cases if not treated early. So he was diagnosed with this condition. His father was diagnosed with this condition. His brother was diagnosed with the condition. So not only he saved his own life, but his brother's life, his father's life, and subsequent generation as well. So awareness about heart disease is extremely important. Any palpitation, dizziness, collapse, blackouts, uncalled for chest discomfort or back discomfort, neck pain, arm pain, unusual pains, you should definitely get yourself checked, because especially if you have family history, especially if you've got some of the risk factors, because this could be a starting point for problems related to the heart.
But sir, what also happens is that when you have a pain in the chest or in your abdomen, in your arms, you always confuse it whether it's a heart condition or whether it is a gastric issue, and the pain in the shoulder, whether it's a spondylitis versus a heart condition. And many a times, you tend to ignore it, कि ठीक है, हुई थी, खत्म हो गई, maybe it was just a gastric issue. But the pain happened and people do not get it checked. Is there a way for a person to understand that, this is definitely something which is related to the heart and is not a gastric problem, or the shoulder pain is definitely related to something other than the spondylitis, so that they could go meet their doctor, get themselves checked?
So it's a very thin line between diagnosis for a gastric problem or diagnosis for a heart disease, because both of them can present with upper abdominal discomfort or chest discomfort. If you have got young people who have not eaten properly or had a long gap or are not eating properly, then obviously these symptoms are seen very commonly in younger people. But if these keep happening more frequently, that you're getting abdominal discomfort or chest discomfort more frequently, or it is more than unusual, that you possibly suffer from gastritis as well, because again, there can be a condition where a person is suffering from gastritis, but at the same time, he have another episode that may be a heart attack. So very unusual heaviness, tightness, difficulty in breathing, because difficulty in breathing is almost associated with a heart attack.
Correct.
So again, difficulty in breathing, very heavy chest, radiation in the arm, radiation in the jaw, which has never happened with you before. If you have a family history or if you have some of those risk factors, then 100% you should go and get yourself checked. These days, there's one drop blood test which is called the TROP-T or the TROP-I, which is done in India in every hospital. So you can go to the emergency, get a blood test done. Within minutes, you can know whether this is heart related or not. So I think we should not take it lightly. We should definitely get ourselves checked, especially if the pain or the symptom is more than usual gastric symptoms that you would normally get.
So I think there's a very strong message here that अगर challenge है, अगर दर्द हो रही है, अगर आपको discomfort हो रहा है, at least go and get yourself checked so that you are reassured that it is not a cardiac. I mean, that few moments of or the little bit of time that you spend on getting a professional, a feedback on what is happening in your body could save you from a lot of challenges later.
Absolutely. And one of the other key messages here is that majority of these studies and research have shown that if you think that you are having a heart attack or discomfort, try and reach the hospital within the first 90 minutes, because that is the golden period. If you reach hospital, if you get the angiogram and a stent, whatever is required within the first 90 minutes, you can prevent all those bad effects from the heart attack on the heart long term. So the golden period, the golden window is the first 90 minutes. If you can reach the hospital in the first 90 minutes. And again, another important message here is that we have seen a lot on social media, especially, that somebody is having a heart attack or a cardiac arrest and people are busy making clips about it. CPR is something that should go out in the community, that everyone should be aware of how to do a CPR.
Absolutely.
CPR is something that is not practiced much, that not learned much, but that is something that can save your family's life, your friend's life, somebody else's life. And CPR is something that you should be doing the first thing the moment you see somebody having a cardiac arrest, because with every minute, the chance of survival goes down by 10%. So it is very, very important to start CPR when you see somebody having a cardiac arrest.
Absolutely. I mean, thank you for bringing this up, because I've been talking about it in every platform where I get an opportunity, that when you're looking at training people on CPR, we are trying to go train everyone else in their offices, police, etc. That is really, really important. But I think the training needs to happen in school, so that children grow up knowing what to do,
Correct.
when to do it, and how to do it.
Correct.
And it should be something which is a normal understanding and training that every person on the street should be aware
of.
I think it could save a lot of lives.
There is already a lot of research from many European countries who have published data that effective CPR, early CPR, has saved thousands of lives.
Yeah, absolutely. Dr. Narain, for the last couple of years, especially post pandemic, there has been no conversation which is complete without discussing COVID-19. Especially when it comes to heart care, there have been lot of discussions around people having heart condition because of COVID-19 or as an outcome of COVID-19. Is there evidence so far that suggests that the cardiac arrests are happening either because of COVID-19 itself or the vaccination?
So, as far as the vaccination is concerned, we have enough evidence both from Pfizer and AstraZeneca to suggest that they are the right thing to do. They are most effective vaccine. There always be some side effects, like with any of the drugs. The drug itself does not lead to any heart attack or heart condition. What happens is that if you have suffered from COVID-19 or COVID, there is a likelihood of less than few percent that the heart muscle, because again, it's an inflammatory condition, it can affect any part of your body. So when that inflammation affects the heart, it can lead to myocarditis, which is inflammation of the heart muscle. So there's outer layer of the heart, the muscles of the heart, they get inflamed, and that can lead to myocarditis, which can present with chest pain or palpitation. It is completely treatable. If left untreated, that can lead to heart rhythm disturbances, but the numbers are extremely, extremely low. We have seen possibly in the last 4 or 5 years, we have seen in my hospital, we cater to almost half of London. We have seen 5 or 10 cases of myocarditis in the last 5-10 years related to COVID. So again, the numbers are negligible. So we should not blame all these heart attacks, heart problems, post-pandemic related to COVID vaccine or the COVID itself. But what we have proved that in certain cardiac death patients post-pandemic, we have not picked up even one patient where it was myocarditis related to COVID-19 which was responsible for this. In fact, All India Institute of Medical Sciences has published a report recently suggesting that majority of the heart problems that they saw post-pandemic, it is on the Ministry of Health website as well, that they were not related to COVID-19 deaths or COVID-19 vaccines or COVID-19 infection. So they were related to traditional risk factors, and they have done MRI and biopsies and gene testing, and they knew that this was all related to pre-existing conditions. It had nothing to do with COVID. So I think that presumption and assumption that this is related to COVID and COVID led to this is completely wrong. It has now been proved globally and in India with that report from AIMS. But what is also very, very important, that we still, as I said earlier, we don't have database on young people dying suddenly in India. Unless we have research, database, post-mortem, we will never know. We'll still be in the same situation in 10 years' time discussing this unless we do post-mortems, get a registry, get a database. How do I know that there are 12 people dying in UK? UK is such a small country compared to India. But I know, all cardiologists in UK know that the prevalence and the incidence is 12 young, healthy people dying each week from sudden death. This is research. This is database. We need to do more of that. Unfortunately, the way medicine is practiced in India, unfortunately, we are the biggest, most populous country in the world. So there are lots of different challenges. But at the same time, it is important that we bring research into our clinical practice that will help our generations to come.
Absolutely. And I think, whether COVID or not COVID, in any case, I think it is time that we should be introspecting every case related to heart, because like you mentioned earlier that it is not the challenge of the heart. What has led to this condition needs to be studied.
Correct.
I mean, there's a research that has brought out that we know today that diabetes and blood pressure, hypertension
They are all
together
related. Correct. Absolutely.
create a heart challenge.
And that leads to using the right medications. We were talking about
Absolutely.
some medications earlier
Absolutely.
as well, that there are so many newer medications out there that has got huge advantage in prevention long-term heart attack, stroke, and to name some of them, SGLT2, GLP-1. These are some diabetes drugs, some weight loss drugs, which has got massive data. So having an SGLT2 drug as a diabetic patient,
Right.
SGLT2 drugs are drugs like dapagliflozin and empagliflozin, which is easily available in India. These drugs can prevent heart attack and stroke by 30%.
Right.
It can prolong the chance of developing dialysis related kind of kidney failure by up to 15 years in a diabetic patient. These are magical pills.
Right.
Every diabetic has to be on an SGLT2 unless there are small situations where if you're getting frequent urinary tract infections or some other side effects. Majority of the diabetic patients will be able to tolerate this. I don't let any diabetic patient go out of my clinic unless they are on an SGLT2 drug. And similarly with GLP-1 drug, which is weight loss drug that we are using a lot, Wegovy kind of drugs, those drugs again have showed a lot of evidence that it prevents heart failure, heart-related problems, rhythm-related problems. So again, a lot of positive impact, not only on the weight and diabetes, but also on the heart long-term.
Absolutely. Dr. Narain, let's just zoom out from the patient and zoom in to the system itself. There are two things that impact healthcare. One is research and the second is training, because every healthcare worker today needs to upskill, reskill with newer therapies, newer technologies. First, let's address the research. I mean, since you were talking about what we have found out, what works, what does not work, are there any research gaps that we have identified that need to be filled today, whether at the end of the pharma company or whether at the end of the doctors, surgeons, therapists working with the patients?
Very important question. And I think, all of us play important role in research. When it comes to research, whether it be a healthcare professional like doctor, nurse, paramedic, pharmacist, because again, worldwide, everyone is part of the research. Everyone is a co-principal investigator or a co-investigator in every research. Because at the moment we are doing a research on lipid drugs. There are at least 20 new drugs coming out in the lipid space. And we are doing extensive research in the UK and Europe on many of these lipid drugs, for example. So yes, everyone has to play a role, including the pharma companies in India, because in India, there are hundreds of pharma companies. Pharmaceutical is a big thing in India. They should definitely take more help from the HCPs and contribute towards this research and proactively support these research, because, and more importantly, the government has to be more proactive, because there are so many bureaucratic hurdles that I have faced myself when I'm trying to do something in India. So I think the Prime Minister is trying to do that, but I think the Health Ministry needs to be more proactive in allowing this research to happen in the right way. I'm not saying that we have to allow everything to happen, but again, the right way it is as it is done globally. So bringing all those research ideas, concepts, implementing those research, building up your database and having a registry of all these problems with heart disease, diabetes, cancer, mental health, because unless you have a database, you will never be able to change your practice. Right. We are changing our practice based on the research. Every few months discussion is happening that this kind of shift has happened in the patient population. This kind of shift has changed the way patients are taking their medication. So all those changes in the research leads to better clinical outcome for the patient. That's why you're doing the research, to give better service to your patients. Unless there is research, that change will never happen.
So, you're a healthcare practitioner. You understand the Indian healthcare system as well as you see what happens in the UK. The challenge that we face in India is that we have less number of doctors compared to the number of population that people that they serve, and they don't get enough time to go rescale, upskill themselves to do research. I know doctors in the hospitals, because of the need for them to serve the patients, the requirement at the hospital, they go write papers, they research. But people who are working in standalone clinics, I've I've rarely seen them getting involved in research activities. What do you think needs to change? Because the role of a doctor can be far more meaningful if they were to share their data, share their learnings, share their observations to actually bring the change. It's not just the responsibility of a pharma company.
Correct. Very good point. For me to keep going back on the doctor's register at the General Medical Council in the UK, I have to have an assessment every year. An appraiser will come and assess what are the things that I have done in the last 12 months apart from just seeing patients. And that includes my CME hours, continuing medical education, my research, my contribution to the other parts of the healthcare system. So it's a holistic approach that we have to adopt, because for me to pass that assessment and go back on the doctor's register in the UK every year, I have to make lot of effort, not only just to see patients, but also do some research, some audit, attend all those big conferences, get my 50 plus CME credit points. So I think a system has to be there which does not exist in India, that once you're a doctor on the register, there's no system of appraising you. Even professors in their 70s are getting appraised on a yearly basis in the UK because they want you to go and learn what is happening out there in the world. You cannot just get your MBBS and then forget about medicine. Medicine is not just as you learn from textbook. It's an art. It's an ongoing research around the world. Every day there is something new happening. And if you are not aware, then you will not be able to give all those right medications to your patients, right strategy to your patients, right guidelines to your patient. So two things is very important. Our formal system of appraising the doctors on their register by the healthcare system, by the Ministry of Health should happen. Some kind of system has to happen, that what have you achieved apart from just seeing patients. I know there are busy clinicians who will never get time to do anything like this, but you have to take out time to upskill yourselves, learn, to know what is happening in the world of medicine, in the world of cardiology, diabetes, whatever you are practicing, because the whole world is doing it. Then why not we can do that in India? So research is extremely important, and upskilling and learning new skills, learning new technology, learning new skill sets. All that is also very, very important. For example, in cath labs, till recently, we did not have trained cath lab technicians, which are called cardiac physiologists in India. To become a cardiac physiologist, to help a cardiologist to do an angioplasty, you have to have a 4-year course globally. That system did not exist in India till recently.
Right.
So a modified compounder or a helper would just go and assist the cardiologist in helping putting the stent or inflating the balloon for stent. So I think changes are required. We should follow what is happening around the world. Research is extremely important. Upskilling, training, educating yourself, because education cannot stop in medicine, cardiology. No matter if you're a professor of Harvard or professor of Stanford or Oxford, you still have to keep reading and learning.
I completely agree with you. We do have a system of CME in India. The doctors need to have those CME points, but I think research is something which has not yet been addressed as clearly as it should be. And I think another issue, another point that you really made is upskilling, reskilling, upgrading yourself, getting yourself trained with the new technology. Because I think if you do not get yourself trained on the most modern technology which is available, which is making the treatment better and safer for the patient, I think it is an issue of ethics that is there.
Absolutely.
And that needs to be addressed.
100%. For example, heart failure has become one of the biggest challenges globally. We now know that there are more than 64 million patients with heart failure globally. How did we know this? Till recently, we thought the numbers around 30 million. But the recent data from Salim Yusuf from Canada, again, the same global burden disease suggests there are 64 million plus patients with heart failure globally. In the UK, we have more than 1 million patients, but the research and audit now tells us that we are missing on few hundred plus heart failure patients in the UK. How do we know that? Research, auditing your own work, your own practice, and learning from that audit is something very important.
Absolutely. I think the doctor is a lifetime student,
A student.
learner, because every day there's something else or the other coming up which is making, systems much better.
Correct, correct.
You've also been involved in training a lot of these doctors, nurses coming from UK,
Yes.
to do this training in India. Uh, what are the gaps that you have identified that exist today in the training which could otherwise make our doctors and nurses better? And was there some kind of a case where you saw a doctor or a nurse in a
And
situation
yeah.
which helped you identify that, what, this needs to be addressed?
Correct, correct. I think what I have seen in many hospitals recently as well during my visit, when I've gone with a friend or a family to see a doctor, uh, India is a challenging place. As you know that we are one most populous
Correct.
country in the world. The number of patients are flowing everywhere. Every corridor, every hospital is full of patients. So that is a big challenge that India faces. But at the same time, a system has to be adopted where there are two things that I would really like to emphasize. One is I see a lack of empathy and sympathy in delivery of your services.
Okay.
So, 30 to 40% of your problem when you see a doctor is solved by the empathy and sympathy that the doctor shows rather than just the medication. So I think that is extremely important. I have seen my father myself was a professor of medicine in Bihar, and the way he used to talk to patients, the way he used to sit with patients, give them time, understand, that has changed a lot in India. So that really needs to go back to in olden days where you will give time to patient, understand their empathy, sympathy, because they have come from far off places with a lot of expectation. The moment you talk to them nicely, give them some more time, 30-40% of the problems will be solved, 60% can be solved by the medications. So empathy, sympathy has to be implemented at every level, whether it be nurses, pharmacists, paramedics, doctors, everyone. I think we need to do more, and this is again across the board for us as well. Globally, more and more emphasis is there that we should be using more empathy and sympathy. And the other thing is that guidelines-based practice. We are not doing that. If you see yourself as a heart patient and you go see 5 different cardiologists in India, you will always come out with 10 different drugs. That doesn't happen in UK and Europe. It's evidence-based practice. We know that in heart failure, there are 4 drugs, SGLT2, beta blockers, MRA, and ACE inhibitors. These are the 4 drugs that you give in heart failure. And that is practiced around the world. But we also learned from our audit that we are only using those drugs on possibly 40-45% of the patients. 55% patients in UK still are not getting heart failure drugs the way they should be getting it. So evidence-based practice, now that we have learned, we are being more aggressive in implementing the 4 pillars for heart failure. Coming to India, I think more evidence-based practice. We are using a lot of drugs in prescriptions that I have seen of doctors, which again, I'm not criticizing in any way, but maybe more evidence-based practice is required to give better long-term outcome for patients.
What are the 4 pillars?
So the 4 pillars are the drugs that you use for heart failure: ACE inhibitors, beta blockers, MRA, and SGLT2. These are the 4 drugs. If you take these 4 drugs, there's now evidence to suggest with a study called Strong HF that if you start these 4 drugs in a patient with heart failure, their journey of life goes up by 50%.
Wow.
So I think getting all those right drugs is really, really important.
Right. You used empathy and sympathy as the 2 things which are seemingly lacking among the Indian healthcare practitioners while treating their patients. I also believe that, the process of how a doctor builds a rapport with the patient and vice versa,
the moment you see them,
changes the process from treatment to healing.
Yes.
Can you give me an example of what is it that the doctor should or could do that will bring out the empathy and sympathy and be visible and be felt by the patient?
I think one of the things that we are taught, because again, we learn every day of how to improve ourselves, because we have to do several courses every year to go back on the register as a doctor. You have to pass several of those assessments tool. And those tools, again, recently I did my assessment, and I had to go through those trainings where it tells you that you have to be a good listener. So the moment a patient enters your clinic or your chamber, it is extremely important that you be a good listener. You try and listen to what their concerns are, and then will you be able to address that concern in the best possible way. Because again, that person, as I said earlier, has come from far off distance to meet and with a lot of expectation. And if they don't get enough time, empathy, sympathy, and consideration that they were expecting, that they feel they lose the confidence in that person, in that doctor, that he didn't give me time, he didn't understand my problem. And I see this very frequently. So I think I completely take this point that you cannot compare the healthcare system in the UK, where we possibly see 20 patients in a day compared to 100 that you will normally see in outpatient in India. Population is a big challenge. So maybe I think more strategically, we have to have more doctors, as you know, that we have to have more doctors, whether it be government hospitals or private hospitals, and giving more time to patients, listening to them, and more empathetically, sympathetically is very, very important.
Right. Dr. Narain, my last question to you is on the development that we've seen in healthcare per se. And a lot of development within healthcare has happened which impacts the heart care. We've seen surgeries becoming better, we've seen surgeries becoming safer, we've seen transplants being successful, we've seen robotics being there. On the preventive side, we've seen AI coming into screening processes.
Correct.
We've seen wearable technology which is accessible to people. And on the drugs, you've been talking about SGLT2 and GLP-1, which are now accessible, available to the patients. If you look at 10 years ahead, what will heart care look like in your perspective?
Given a choice that if I have to dream what heart care will look like in 10 years' time, I think every evidence and research guidelines, pathways suggest that prevention is the key. Because as I said earlier, the moment you develop any of those heart conditions or stroke or any other cardiovascular conditions, that inflammation, that change, that fibrosis, that increase of bad hormones, they start in your body. So what we really need to do is to stop it from happening in the first place. Obviously, if you've got very bad family history of heart disease that it is likely to affect you in your 40s and 50s, maybe the impact may not be as bad if you start early with your prevention. So I think an ideal heart care situation in 10 years' time would be less number of heart patients. I'm not saying that the global burden disease data is wrong, but I wish I could prove it wrong by bringing the incidence and prevalence of heart disease, diabetes, globally and in India and subcontinent, especially because we are seeing many cases here, as low as possible, because prevention is something that will lead to less number of these patients.
Dr. Narain, thank you so much for your conversation. What today's discussion makes clear is that heart health is not just a medical matter, it's a human one.
Correct.
And when you spoke about that, every healthcare practitioner, every doctor, every physician needs to bring that empathy, compassion, sympathy. In fact, not sympathy, but compassion and empathy in how they deal with the patient could make heart care being practiced with a lot of heart.
Correct. Absolutely.
So, every doctor needs to be a good listener is a big message for the healthcare system. And so thank you so much for taking out time to have a conversation.
Thank you so much for having me.
Thank you.
Thank you so much.
Thank you.